for joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. I will now turn it over to Dr. Garza.
Okay, thank you. Good afternoon, everybody. Hope everyone had a pleasant weekend. So we're beginning to see some mixed signals in the pandemic right now, and we'll talk about that in a little bit more detail when we look at the numbers. First, the sort of good news is that our total number of COVID-19 patients in task force hospitals is considerably lower than when we were at our peak. However, it is still too high, but that overall number of patients in hospitals has been trending in a better direction. So again, that's some good news. Now, the challenging news is that we're still seeing a high number of patients being admitted to the hospital with the virus. And we continue to be averaging anywhere from around 90 to 100 new patients a day. And that's still a really significant number of people being admitted every day to the hospital, particularly when we're still waiting to see if we're going to have any surge from the holidays. So if the number of new COVID patients increases because of the holidays, any progress really that we've made since that peak time is going to become undone, and that stress to our healthcare system will rise again. Now, vaccinations are going to help, but as everybody knows, we don't have enough vaccinations in the community right now, and that's not going to happen anytime soon. So, but what can happen is people can still get sick and still get sick enough to be admitted to the hospital. So it's important that we don't forget all of those mitigation strategies that we've talked about now for almost close to a year, of wearing a mask, staying socially distant, not gathering in crowds, all of those things. But let's look at today's numbers and we'll see where we are. So as always, we start with our graph highlighting our regional hospital admissions, and as I said, it's been trending down slightly, but still very high. So today we're reporting 81 admissions of COVID positive patients, and again, this is delayed by 2 days. And our 7-day average remains still very high at 94 admissions. Looking at our hospitalizations, today we're reporting 782 patients hospitalized, confirmed COVID, and that moving average is at 780. So still a very high census of patients in our hospitals with COVID-19. A little bit more detail on our numbers today. As I said, we have 782 patients admitted to the hospital with COVID. We have 156 COVID positive patients in our intensive care units, and we have 94 patients that are COVID positive that are on ventilators, and that's compared to 98 yesterday. Looking at our suspected COVID patients now, we have 70 patients hospitalized today with suspected COVID. We have 7 suspected COVID patients in our intensive care units, and we have 5 suspected COVID patients on ventilators today in our task force hospitals. Moving on to our good news slide, we discharged 55 patients yesterday from our task force hospitals, and that number seems a little bit low compared to some of those numbers that we've had over the last couple of days where they're up into the hundreds. We've discharged 15,736 patients from our hospitals cumulatively throughout the pandemic. And again, a big shout out to all of our healthcare providers that have got these patients well enough to go back home. Unfortunately, we continue to see deaths across the metropolitan area. Today we're reporting 20 COVID deaths in our task force hospitals. Yesterday they were 10, so you can see that that data moves around quite a bit. The 7-day average is 18 deaths per day over the last 7 days. model. So you can see we're trending anywhere between our best guess line and the lower bound of our best guess. Now certainly we're glad that we're not on that steep curve that the orange lines were, but you can also see that the blue line is rather flat or decreasing slightly. So still it's going to take us some time to decrease the number of patients that are in our hospitals, according to the model. We do put in a couple of different scenarios just to see what we need to plan for. The red line represents if we had a dramatic increase in cases, particularly after the holidays. And the orange line is a favorable outcome, so if we can keep transmission low. So as you can see here, we're trending in between that blue and the orange line, which is good. But it's still, it's a very slow degrading curve, and so it's still going to take us some time before we get a substantial number of patients out of the healthcare system. These are just some enlarged graphs showing where we are with our inpatient census in the models. So again, between that best guess line and the lower bound. And then the same thing with our intensive care unit. That's taken a little bit more of a significant drop here over the past week or so, which is good news, but still in between that best guess and our lower bound. And so we'll take a look at this model again in a couple of days to see if it needs any adjustment, and then we'll report that back on next Monday. Going through a couple of our other data slides, so this is the epi curve for the St. Louis statistical area. You can see it came down. Again, that was around the time of the holidays, so we were thinking that's probably because of the testing sites were not doing as many samples as they were previously. But we've sort of plateaued, if not ticked up a little bit, and that is shown here in this cases by county, where most of the counties now are starting to see sort of that rebound from the holidays. So starting to see those cases come back up to where they were previous to the holidays. And that's pretty ubiquitous across the metropolitan area. Some have increased sharper than others, but nonetheless the curves have been very similar across this statistical area. For the cases across Missouri metropolitan areas, again, that curve remains pretty similar across most major areas. I will just point out that Springfield did not see that significant drop that we saw from the holidays. And in speaking with some of our partners that have facilities down in Springfield, they confirm that they are still seeing a high level of cases down there, as well as still a high level of hospitalizations, and so something to be aware of. Looking at our reproductive number, you can see that we're still, well, we sort of jog in between going below 1 and then above 1. We're sitting a little bit above 1 right now. Again, takes a lot of active suppression in order to keep that number below 1. So some weeks we're better than others. We're hovering around that 1. Anything that we can do to suppress it even more is the right thing to do. If you remember last week, this map was mostly blue. And as I explained last week, it's due to that drop in numbers from the holiday season. And again, it's not really a drop in cases, it's really a testing phenomenon. So if you're not testing as much, you're not going to have as many positive cases. And I said, don't be surprised next week when I come back and this map is all brown. And it is. Now, certainly there's a higher percentage in some counties compared to where they were the week before, and I think that's Warren County that has sort of that burnt orange or that brownish color. But really, almost across the entire metropolitan area, there's been more cases over the past 14 days than the previous. And then just pointing out a couple of highlighted areas where we saw some significant growth in cases week over week. The 2 on the Missouri side, or 3 on the Missouri side, were St. Charles, St. Peter's, and Imperial. And then on the Illinois side were O'Fallon, Belleville, and Shiloh. Okay, so that's an update on where we are with the pandemic. So we're going to go ahead and close out now. But with a couple of words, it's really important time for us to see what that impact is going to be from the holiday. And so we're barely 2 weeks into the new year, so we'll need to wait another couple of weeks to see what that final impact is from both Christmas and from New Year's. Now, hopefully, it will remain low, but we'll keep our eye on it, and we'll see what's going to happen. There's a couple of other headwinds we're still tracking to see if that UK variant has made its way to the metropolitan area. So far, we haven't heard anything, but we know samples are still being sent to the CDC, and so we'll keep our eye on that. As most people have probably heard, it's more transmissible than the current virus that's circulating, and so we want to make sure that that's not going to cause further issues in the metropolitan area. But the things that we can do to prevent spread are the same with that UK variant as they are with the virus that's circulating now. And that is wearing a mask, staying socially distant, and not gathering in crowds, as well as washing hands and surfaces and all of those other things. So the recommendations don't change. It's just, are we at higher risk for more hospitalizations and cases because of this new variant? We're continuing to work through the vaccination schemes as well, as quick as we can. But while we wait for those vaccinations to be extended out to broader groups of people, we all have to do those things to prevent spread, and that's where the public really comes in. So I don't believe we have any questions from the media today, so we're just going to go ahead and sign off now. Thanks for listening.